CEN Test Prep Exam Unit 3. Question 1. Pulsus paradoxus is a classic finding in which condition? Option A. Cardiac tamponade. Option B. Pulmonary embolism. Option C. Aortic aneurysm. Option D. Congestive heart failure. The correct answer is option A. Cardiac tamponade. Question 2. The best method to remove a prosthetic eye in an emergency is: Option A. Using forceps to grasp the prosthetic. Option B. Applying suction with a bulb syringe. Option C. Using a suction cup designed for prosthesis removal. Option D. Sweeping a finger around the edge to break the suction. The correct answer is option C. Using a suction cup designed for prosthesis removal. Question 3. Which of the following is the priority assessment when a patient is found to have rhabdomyolysis? Option A. A neurological status. Option B. A renal function and urine output. Option C. Skin integrity. Option D. Cardiac rhythm and rate. The correct answer is option B. Renal function and urine output. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 4. In distributive shock, the primary pathophysiology is: Option A. Pump failure. Option B. Widespread vasodilation and increased capillary permeability. Option C. Fluid volume loss. Option D. Obstruction of blood flow. The correct answer is option B. Widespread vasodilation and increased capillary permeability. Question 5. The antidote for acetaminophen overdose is: Option A. Naloxone. Option B. N-acetylcysteine. Option C. Flumazenol. Option D. Sodium bicarbonate. The correct answer is option B. N-acetylcysteine. Question 6. The hallmark sign of compartment syndrome is: Option A. Pain relieved by elevation. Option B. Pain out of proportion to the injury. Option C. Absent pulse in the affected extremity. Option D. Pitting edema. The correct answer is option B. Pain out of proportion to the injury. Question 7. The golden hour for acute ischemic stroke refers to the window for: Option A. Completion of an MRI. Option B. Administration of 4 thrombolytics, TPA. Option C. Achievement of blood pressure control. Option D. Initiation of physical therapy. The correct answer is option B. Administration of 4 thrombolytics, TPA. Question 8. Fat embolism syndrome is most commonly associated with fractures of the: Option A. Distal radius. Option B. Pelvis and long bones. Option C. Clavicle. Option D. Metatarsals. The correct answer is option B. Pelvis and long bones. Are you looking for CEN exam actual questions? Visit our website pokerexams.com to access CEN exam study guide with actual questions and answers. Scan the QR code or click the link in the description to get CEN exam answer key today. Question 9. A patient with a traumatic brain injury exhibits decerebrate posturing. This indicates: Option A. A damage above the midbrain. Option B. A damage at or below the midbrain/brainstem. Option C. Damage to the cerebral cortex. Option D. A positive outcome. The correct answer is option B. Damage at or below the midbrain/brainstem. Question 10. Which type of shock is characterized by decreased cardiac output, elevated systemic vascular resistance, SVR, and jugular venous distension? Option A. Hypovolemic shock. Option B. Distributive shock. Option C. Cardiogenic shock. Option D. Neurogenic shock. The correct answer is option C. Cardiogenic shock. Question 11. A patient with acute respiratory distress has the following arterial blood gas: pH 7.22, PaCO 258, PaO 262, HCO 324. This represents: Option A. Uncompensated respiratory acidosis. Option B. Compensated respiratory acidosis. Option C. Uncompensated metabolic acidosis. Option D. Compensated metabolic acidosis. The correct answer is option A, uncompensated respiratory acidosis. Question 12. A female patient of childbearing age with abdominal pain should always be evaluated for option A, ovarian cysts, option B, pregnancy status, option C, endometriosis, option D, PID. The correct answer is option B, pregnancy status. Question 13. A patient with acute pancreatitis should have which nursing intervention as a priority? Option A, encourage early ambulation. Option B, keep the patient NPO and provide aggressive 4-fluid resuscitation. Option C, administer high-fat diet. Option D, restrict all 4 fluids. The correct answer is option B, keep the patient NPO and provide aggressive 4-fluid resuscitation. Question 14. Which of the following is an early, compensatory sign of shock? Option A, anuria. Option B, metabolic acidosis. Option C, tachycardia. Option D, unconsciousness. The correct answer is option C, tachycardia. Question 15. What is the classic sign of a basilar skull fracture? Option A, Battle's sign, mastoid ecchymosis. Option B, rhinorrhea with glucose minus negative fluid. Option C, hemotympanum. Option D, all of the above. The correct answer is option D, all of the above. Question 16. A hyphema involves option A, retinal detachment. Option B, a blood in the anterior chamber of the eye. Option C, ruptured globe. Option D, corneal laceration. The correct answer is option B, blood in the anterior chamber of the eye. Question 17. Which of the following is a sentinel event that requires reporting to the Joint Commission? Option A, a patient fall that results in a minor abrasion. Option B, a medication error that causes no harm. Option C, a surgery on the wrong body part. Option D, an AMA discharge. The correct answer is option C, surgery on the wrong body part. Question 18. A patient presents with a painful, red eye, cloudy cornea, fixed mid-dilated pupil, and increased intraocular pressure. The nurse suspects option A, open-angle glaucoma. Option B, acute angle-closure glaucoma. Option C, a conjunctivitis. Option D, uveitis. The correct answer is option B, acute angle-closure glaucoma. Stressed about your CEN exam? We can take CEN exam for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done. Question 19. The most common cause of acute renal failure in hospitalized patients is option A, glomerulonephritis. Option B, acute tubular necrosis. Option C, renal calculi. Option D, pyelonephritis. The correct answer is option B, acute tubular necrosis. Question 20. A patient with a suspected spinal cord injury develops hypotension and bradycardia. The nurse suspects option A, hemorrhagic shock. Option B, neurogenic shock. Option C, cardiogenic shock. Option D, anaphylactic shock. The correct answer is option B, neurogenic shock. Question 21. A patient with a Glasgow Coma Scale score of 8 requires what immediate intervention? Option A, pain medication. Option B, intravenous fluids only. Option C, the immediate endotracheal intubation. Option D, a neurological reassessment in 15 minutes. The correct answer is option C, immediate endotracheal intubation. Question 22. A nurse is caring for a patient with a suspected pelvic fracture. The presence of blood at the urethral meatus indicates the need to option A, insert a urinary catheter immediately. Option B, perform a retrograde urethrogram before catheter insertion. Option C, irrigate the bladder with normal saline. Option D, prepare for suprapubic catheter. The correct answer is option B, perform a retrograde urethrogram before catheter insertion. Question 23. A drowning victim who was submerged in cold water has a higher potential for successful resuscitation because Option A, cold water causes coronary artery dilation. Option B, hypothermia decreases metabolic demand and provides neuroprotection. Option C, cold water flushes the lungs of bacteria. Option D, the mammalian diving reflex eliminates the need for CPR. The correct answer is option B. Hypothermia decreases metabolic demand and provides neuroprotection. Question 24. The emergency nurse is caring for a patient with suspected pericardial tamponade. Which triad of findings, Beck's triad, is most consistent with this diagnosis? Option A, fever, chest pain, friction rub. Option B, hypotension, muffled heart sounds, distended neck veins. Option C, hypertension, bounding pulses, headache. Option D, dyspnea, crackles, pink frothy sputum. The correct answer is option B. Hypotension, muffled heart sounds, distended neck veins. Question 25. A patient with known cirrhosis presents with massive hematmesis. The nurse suspects bleeding from option A, peptic ulcer. Option B, esophageal varices. Option C, a hemorrhoids. Option D, Mallory-Weiss-Tear. The correct answer is option B, esophageal varices.